whenever I interact with someone who's hesitant, I want them to feel cared about, and I think the best way for someone to feel cared about is for me actually to listen. Oh man, it feels good to take off that mask. I'm Jeremy Blanchard. I'm the Chief Medical Officer for North Mississippi Health Services, and I'm taking off this mask because one, I'm social distanced from the people who are shooting this video, and two, I'm in an area where there's good ventilation, so I know that even if I have the virus, I'm not going to infect someone. But I really wanted to have a moment to talk to you specifically to share some thoughts and some questions that I've heard. For me personally, I want to honor each individual's decisions. So whenever I interact with someone who's hesitant, I want them to feel cared about. And I think the best way for someone to feel cared about is for me actually to listen what their concern is or why they're making these choices, and ask them if there's things, if I have the information that I can possibly help with. I think the hesitancy, if you look at the national literature, is a couple different groups. One group that's hesitant is the group that is in a place where they can't get to the vaccine. So it's sort of a societal obstacle to them getting the vaccine. In Mississippi, for example, if you don't have a computer or a lot of patients on the phone, it's very difficult to get set up for a drive-through vaccine appointment. So that could be seen as a form of hesitancy, but it's one that we've actually created. The other concern people have is that, and I've heard this in both the United States and others when interviewed, is that it was made too fast. Why is it faster? It's sort of interesting because they actually did what we want done with everything. They created efficiency, they created accountability, and they maintained the process, but they took away the gaps in between. Initially, when people would want to do a vaccine, they would do a very small amount because the companies did not want to invest in a large research and development for a vaccine that may not work. But in this setting, they were incentivized financially to make vaccine in huge volumes with the hopes, one of them, that would work, but not the assurance that they would, because we were really dealing with a pandemic, and we still are.